But this platform, Natural Link Radio, is a platform of hope. It's a platform of inspiration to give you inspiration and, of course, health. And today, let me just give you a little bit of inspiration. But before then, I just want to introduce the topic for the day. The topic here for that English section here is nephritis. Nephritis, the full name is glomerulonephritis. That is GN for short, glomerulonephritis. So it's nephritis is a kidney disease, is inflammation of the tubules. The tubules, we have about 1 million in each kidney actually. So these tubules can be inflamed and possibly damaged in nephritis. And this is what we're going to talk about. Want to know about it, understand it, and know the causes, and then the symptoms, and then the complications. So I'll be taking you through very, very, very soon. But then let me just inspire you a minute, and then we go to the topic. You see, Socrates, we know this philosopher. The Socrates' most famous statement said, the only true wisdom is in knowing you know nothing. The only true wisdom is in knowing you know nothing. What am I saying here? It is very important that we should continue to be hungry for true knowledge, not just about knowledge, every knowledge, because there's some sort of knowledge that can be very dangerous, that can lead you to distraction. So it's very important to have the true knowledge. Even in the Bible, God rejected his people because of what? Lack of knowledge. And it can lead to distraction, not only spiritual distraction or spiritual death, but also physical death. So it's very, very important to seek the true knowledge and be hungry for it every time. And as you know, today you've been listening to Dr. James. I'm a certified natural medical practitioner based in London in the UK. I'm also a gerontologist, natural gerontologist. Actually, it means that I specialize in the aging diseases like diabetes, kidney problems, cardiovascular problems, between heart diseases, bone problems. I'm also a health educator. And so we're based in London in the UK. So today's topic, let's come to it and let's start right away. It's about nephritis. The long form of the name is the glomerulonephritis, GN for short. And it's simply an inflammation of the tiny filters in your kidneys. That is the glomeruli or glomeruli. That is the filters, that filtering system. Unfortunately, in nephritis, it is inflamed. It's inflammation. And this glomeruli remove excess fluid or, of course, fluid, the minerals, that is the electrolytes, and pass them into your urine. It can come on suddenly. That is, we call that acute form. When it suddenly starts, it's called acute form. Or it can be very gradual. The disease can develop gradually. That is, we call that the chronic form, chronic nephritis. It's a condition in which changes in the structures of your kidney can cause swelling and the inflammation in your body, but especially in the leg and then in the face. That is in nephritis. So if your glomeruli are damaged, your kidneys will stop working properly and it can go into kidney failure. But now let's understand the causes of the acute and then the chronic form of nephritis. Now let's start firstly with acute form, that the causes of the acute nephritis or glomerulonephritis. Now, it can be a response. The primary cause is that it can be a response to an infection, like strep throat, the strep throat or abscess tooth. if you have a dental problem, your body can overreact, and that can cause a real problem to the kidneys. But normally it's for short, limited time, and then it leaves you and you are free. But there are certain diseases that are also known to trigger acute nephritis as well. That diseases like lupus. Lupus is an autoimmune disease too that also causes inflammation of the organs like the kidney, the lungs, your heart. And so it's really very important for every individual to have a fine-tuned immune system. That's really important, so that once your immune system is working, you can avoid all these problems. And there's also another condition is called amyloidosis. Amyloidosis is when there's abnormal protein that can cause harm because of a protein buildup in the organs and the tissue. You see, when there's too much protein in your body, or when you even consume too much protein in your body, into your system, your kidneys overwork. That is why too much meat or too much protein can be a disaster or can be very damaging to your kidneys. But sometimes there is a health condition that is called amyloidosis that can build up unnecessary protein in the body and can cause this acute form of glomerulonephritis, or nephritis for short as well. Now, let's also have a look at another cause of acute form. That is the use of painkillers. Painkillers do not only kill your pain, as I always say, painkillers also kill your kidneys, your liver, and your heart, and your gastric system. So you have to be aware of that. But let's have a look at the chronic nephritis, the causes as well. The chronic form of glomerulonephritis or nephritis can develop over several years. This can cause irreversible damage to your kidneys, and ultimately it can lead to complete kidney failure. So chronic glomerulonephritis doesn't always have a clear cause, actually, but the research has shown that, well, about 3% of it, the causes, it could be genetics. But you see, genetic, I always say, in all diseases, it's just a loaded gun. It's a loaded gun, but your lifestyle will trigger this loaded gun. So even if you have a genetic disposition for this disease, it's only up to you how you live your life that will trigger this problem. But another cause can be your immune system disease. As I said, immune system can affect everything. If the immune system is not working as it should be working, it can also affect or lead to chronic nephritis. Also, people with a history of cancers can also have this problem, because people that had cancer issues, normally they might have gone through chemotherapy and so on. So this chemotherapy can really damage the kidneys, actually, and the liver. So such individuals may have problems with the kidneys in the future. Now, having an acute form may also lead to a chronic form of this disease. So if you have acute form that is sudden starts and you don't treat it well, it can lead to chronic form of the disease. But now let's come to the symptoms of glomerulonephritis or nephritis. But before I give the symptoms, or I tell you the symptoms, please just listen to this telephone numbers, and you may give me a call. And if you have any kidney problem, even if you're on dialysis, or you feel that your kidneys even are working fine, we have certain formulas that you can take to protect your kidneys, to preserve them from damaging, because there are a lot of challenges, especially those people that take painkillers and then the synthetic medications, and those people that are worried. If too much worry even can cause kidney damage, and overloading your system with too much water too much water can also cause problems, and then of course table salt can also cause damage to the kidneys. But so give me a call. One call away and then everything is going to be okay. Calling outside the UK is +44 738 464 7300. If you're calling within the UK, is 0738 464 7300. If you call that's okay. Sorry, second number here. Outside the UK is +44 745 988 9152. Calling within the UK is 0745 988 9152. So you can give me a call and you will see that your life will never be the same. As I said, everything I talk about on this platform, there is a solution to this problem every time. And I will say prevention is always better than cure. We have a product called Renacol. It's made up of several herbs, protective herbs that you can take at least to maintain yourself. And we have about 15 different formulas that if someone has someone has serious kidney problems, kidney failure or on dialysis, or acute form or chronic kidney disease, we put together, and with therapies and advice, the kidneys can revive. There's always hope for you on this platform. Let's come to the symptoms of glomerulonephritis or nephritis. Now, the symptoms of acute nephritis is normally puffiness in your face, because your body can't get rid of water. So and then also the filtration rate, the glomerular filtration rate also reduces. So your body cannot filter blood well. That is in the acute state as well. And there's less urine production. So that individual also doesn't pass enough urine. So that is also quite typical symptom of acute nephritis. So there is a less urine often in the day. And then when we move on, we see blood in your urine. Normally the color of blood is Coca-Cola color or the tea color. It means there's a presence of blood in your urine. Also, there's extra fluid in your lungs. Because there's extra fluid in your lungs, that individual may find himself or herself coughing all the time. Even after a lot of treatment, the person will still be coughing. So when you have chronic cough, don't joke with it. It could be underlying serious problem, long cough problems. If you have cough problems due to cold or flu, it should take just a week for it to vanish. But if there's a real problem like 3 months, 4 months, 6 months coughing, know that there's a serious problem, and one of them could be a kidney problem. Another symptom is high blood pressure. It's a high blood pressure because of high blood volume. Your blood pressure increases. So that's also quite typical of acute form of nephritis. But let's have a look at the symptoms of a chronic nephritis. The chronic form, as I was saying, it goes on slowly for some time without any symptoms. So before even you see any symptoms, the disease might have already developed. In fact, not only in nephritis, but every disease. Disease development, it's 6 levels. And the 5th level is the symptom level. So if you see any symptoms that the disease is producing, it means that the disease has already developed, or diseases have already developed in that case. So the first symptom here is blood or excess protein in your urine. So you see your urine will be bubbly or foamy. And then also you can see sometimes blood or that Coca-Cola kind of color or tea color of your urine. And there's also high blood pressure and a swelling in your ankle or ankles, and then the face. You have a puffy face. And there's also frequent nighttime urination. Frequent nighttime urination. So if you have these symptoms, you have to know that it is not just anything. Normally, if you don't understand them, you just ignore them, and then the disease may move to the very final phase, and that is the sixth level of disease development, and that we call that the irreversible stage of disease. Normally, it's difficult to treat it, but you can reverse, but it takes longer time, and it costs unnecessary money. So that's what. Why don't you, even if you don't have problems with the kidneys, why don't you try to prevent it? Why don't you have the true knowledge about how to take care of your kidneys? Because the kidneys are really organs that you can't underestimate at all. They are wonderful organs, and the dialysis can't replace them in any form. If you remember what I told you about the kidneys at the beginning, they're so important. You see, the kidneys, they do a lot for us. Just let me just remind you. If you know what the kidneys really do, then of course you know that if you have dialysis, the machine cannot do that. You see, the kidneys are responsible to control the production of red blood cells. Red blood cells, these cells carry oxygen in your body, because the kidneys have to instruct your bone marrow to produce the red blood cell to carry oxygen in your body. So dialysis cannot do that. And another thing is that the kidneys, of course, remove waste, but they do it efficiently, and dialysis cannot do that efficient as the kidneys. The kidneys help keep the bones strong. It helps keep the bones strong. So bone health depends on the kidneys, because the kidneys help produce an active form of vitamin D, which is very important. Dialysis cannot produce vitamin D. So you have to remember that. You see, kidneys cannot be, the function or the help of the kidneys can no way be underestimated. So we shouldn't joke at all with the kidneys at all. Now, you see, in the UK alone, about 45 premature deaths happen in the UK every year. They die before their time. And normally it affects Black community and Asian community more than the other communities. And then, kidney transplant is not a cure at all, because research has shown that it only provides 50% of a normal kidney function, and it requires the recipients to take medicines for the rest of their life to really bring their immune system to zero. So the person is normally open up to bacteria and viruses. So the person can easily die from virus and bacteria if the person has a transplant. You see, only 20% of those with kidney failure will be able to receive a transplant. So I'm saying all these things to do everything to keep your natural kidneys, not to do any transplant at all, or not to be a victim of dialysis. Yet once a person reaches the age 40, the number of functional nephrons, that is the tubules, the filtration tubules, start going down. So that's why it's very important. Every organ needs certain nutrients to feed the cells of these organs. So if these organs get the right nutrients, they can work and they can be functional at a very high age without coming down. And the food we eat, the food we have on the shelves, normally they are about 50% depleted of nutrients. That's why it's so important for us, all of us, to take additional nutrients that will support your organs. And every organ needs specific nutrients to function well. You see, the kidneys can't be underestimated at all. It pumps about 400 gallons of recycled blood every single day. And when you are anemic, and you are taking maybe iron tablets, and so you've been taking that and still you are anemic, you have to know that it could be the kidneys. They are malfunctioning. And if you are a high blood pressure patient and you've taken all the medicines in the wet and still your BP is high, it means that your kidneys are coming down. They are not working because the kidneys control blood pressure. And so if they are constantly high after taking all the best medicines, you have to know that something might be wrong with your kidneys. So when we say kidney failure, what is it? When your kidneys are failing, it simply means that your kidneys lose the ability to sufficiently filter waste from your blood. They filter blood all right, but not sufficiently. So that is, we call that kidney failure. How do you know that you have kidney failure? Let's listen carefully. The following symptoms. Put all of them together to know that it's really kidney failure. First is constant fatigue, lack of appetite. You feel nausea, and then sometimes vomiting, and then you can't sleep in the night. And then your skin will be dry and itchy. And then there's a muscle cramp at night. Once again, fatigue, constant fatigue, lack of appetite, nausea, feeling like vomiting, and then finally you may vomit sometimes, insomnia, inability to sleep at night. You may have dry skin and itchy skin, and then muscle cramp, especially the calf area. You have muscle cramp at night. If you continuously have that, you have to know that your kidneys are failing. It's quite a serious condition. But now, at this point, let's have a look at the complications of nephritis. Glomerulonephritis can cause damage to your kidneys, as I said, so that they tend to lose their filtering ability. They cannot filter as they should filter. As a result, dangerous levels of fluid or minerals can build up, and waste can build up in your body. And the complications are the following. That's what possibly you've heard: acute kidney failure and chronic kidney disease. This is the first complication of nephritis. And here, your kidneys may lose the ability, of course, to work well. They can't filter blood well, and they can't do their work well. Now, the next complication here is a high blood pressure. Because of the buildup of waste and fluid, your blood pressure can rise. So you see, blood pressure is not a disease, as I always say. If there's a level of toxicity in your blood, your blood pressure will rise because it can impede or it can alter the proper flow of blood in your body. So your blood pressure naturally should rise to compensate that, to really get blood everywhere. And then there's a condition called nephrotic syndrome. It's another kidney disease or a kidney condition that nephritis can lead to this kidney condition. There's another complication that we call that congestive heart failure. This is due to retained fluid or fluid overload. There will be too much water or fluid in your body. Your body cannot effectively get rid of the fluid. And so because of this, your heart may be overworking. And if you're not careful, your heart can even enlarge. And then it can lead to heart failure. This can definitely lead to that. And there's also another complication, that is increased risk of infections due to, of course, low immune system. Because in a kidney disease condition, there are substances, like we call that immunoglobulins. They decrease in your system. And they are very, very, very important. Immunoglobulins are very, very important for your strong immune system. But in a kidney disease condition, these substances reduce and the immune system is impaired. So you see, today we've learned a lot. Nephritis or glomerulonephritis is quite a serious condition. But we have seen that we have the acute form and we have the chronic form. The acute form starts suddenly and it may vanish. But if you don't treat it and that's restore the kidneys or the tubules, that is inflammation of the tubules, then of course it could lead to chronic form. And that through the chronic form of nephritis, it could lead to kidney failure. And then when you go on the dialysis, you have to know that your life will never be the same. But God forbid, I know that you have the true knowledge today. And you're going to do the right thing by preventing and supporting your kidneys. And one secret about health of kidney is that if you want to have healthy kidneys, please have healthy liver. If you have a healthy liver, your kidneys have less work to do. I thank you very much, lovely listeners, for joining me today on this platform. I know today you've learned a lot. And just visit us on YouTube. Please put in Dr. James Natural Link. Once again, Dr. James Natural Link, and subscribe. And just click the like button and support the program and share. And God will bless you, because there are many people that are hungry. They are there and they want the true knowledge. And please, you've gotten it. And so share, and God will bless you and you support this program. Thank you very much for joining me. And as we do every Thursday and Sunday, between 8 and 9, we have Tree and English section. And don't miss it. And please share this good news. And may God richly bless you the coming week. And thank you for joining me today.